audience not to yell out. I'd also like to remind the audience that when the timer goes off and your time is done, you need to leave the podium. If anybody disregards those rules, they will be removed from the meeting. Passages to recovery.
Good evening, Board. Greg Price, Director of Operations for Passage to Recovery. For the month of August, we have current count is 21. We had 0 revocations, 4 escapes, 0 SIHI issues, and no assaults, no non-fatal overdoses, and no hospital EMS runs. Passage to Recovery will be participating in the recovery walk coming up on this Saturday, so our residents and our staff is excited for that. Any questions?
Thank you.
Thank you.
Thank you.
Renewal.
Good afternoon, everyone. Darren Hood, HOOD, Director of Reentry Services with Renewal Incorporated. Current numbers are 109 work release, 32 in inpatient, giving us a total of 141. We have 39 open beds currently. We had 54 reentrants exit the program, 34 successful, 20 unsuccessful. That was 10 escapes and 10 program revocations. Some people were pulled out of the program due to court orders, and others returned for behavioral issues. 0 deaths, 0 non-fatal overdoses, 0 uses of force, 0 incidents of self-harm, and 0 suicide attempts. The number of times emergency medical services were called and reported to either building for county reentrance since the last jail oversight meeting was 5. EMS were called for the following conditions: once for chest pains, a second time for constipation and high fever, third for a seizure, a fourth for adverse reaction to K2, and a fifth for an allergic reaction causing severe hives. And Renewal Incorporated will also be having volunteers at the recovery walk as well. That's all I have.
Questions? Bethany?
First of all, my cousin's getting an award at the recovery walk, so when you see Margaret Manjerovic, I'm really proud of her. So everybody who said they're going to that, we will be there cheering her on, so I'll see yous there. But anyways, the question is about the K2, the adverse reaction. Is that like an automatic revocation and they go back to jail when they went to the hospital for a K2 reaction?
No, there's progressive discipline that would happen. So basically, wait for the urine to come back to prove. That was pretty much hospital discharge paperwork sometimes indicates that there was substance use. They don't specify because they don't get lab work back. So we'll work with them. If it's a second time, a third reoccurring, we'll try and get them in inpatient before total program revocation would occur.
Awesome, thank you.
Is that it?
Thank you.
All right. Have a good afternoon. Thank you.
Electronic monitoring.
Good evening, Board. Steve Aswine for the Probation Office. So for this reporting period, we had 555 individuals on the bracelet. 44 had completed successfully, and 6 were taken back for violations. So, any questions? No. All right.
Thank you. I would like to announce to the public that the board had an executive session prior to the commencement of this meeting to discuss personnel issues. Can I have a motion to approve the meeting minutes for August 2025?
Before that, Judge, were there any public comments?
No.
What about online public comments? Did we have any of those? I didn't see that paper this month.
I think there was one encore. Wasn't there one online public comment that I forwarded to you? Oh, no, there were none. Sorry.
There were no online
Sorry.
comments? Okay,
Yes.
I just wanted to make sure because we skipped that. Thank you.
Sorry, yes, none.
But I'll motion to approve the meeting minutes from the August 20th, 2025 meeting.
Second, anybody?
Second.
All in favor?
Aye.
Any opposed? Motion carries. Old business, updates from Incarceree Welfare Committee. Any updates?
Just that we are in the process of working on what we discussed at our last month's meeting, which was the notification for families, like when someone goes to the hospital, not just that they're dying, but that they went and got a procedure or something. Still in the works, we're reviewing best practices and working as a team to make that happen as soon as possible. I think, especially given some things that happened this past week regarding that, time is of the essence, and we want to make sure it's done right.
Okay, thank you.
You're welcome.
Employee welfare, no updates. Health Services Advisory,
I'm gonna let the warden speak to some of the updates of what
Okay.
we're working on. During the warden's report, we can.
okay, thank you. Lockdown and Use of Force Subcommittee,
No updates.
okay. No new business, so Warden's report.
Good afternoon, Board. I can start with the subcommittee update. So I think we've had a couple really productive subcommittee healthcare meetings. Happy to say that we've talked for a while about having EMS personnel in the intake area of the facility. We now have 4 people there, and we have a 5th being onboarded as we speak. So we're going to have 5 folks working in intake that are certified EMS personnel. I think that's a positive thing for the facility. Much welcomed addition. Also working with the subcommittee, we've talked for the last 2 meetings about bringing telehealth into the facility. I think we've made a lot of progress with AHN. We're still working with other hospital systems, but I think we have an opportunity there to move into an arena of a lot of appointments being handled through telehealth when they don't have to go out to a facility. So we're working through the final phase of that. A lot of that is technology, and it's hospital systems being secure and us being secure with that information. So I think the meetings that we've had with the healthcare subcommittee have been very positive. We've formed some relationships with those folks, and we continue to work towards improving, starting in intake, but in the whole entire facility regarding medical services. I appreciate that partnership with all the subcommittees. Proud to announce that Gerald Roundtree, he's one of our unit managers we brought on in February or March. He has been chosen by the Pennsylvania Prison Society as their Correctional Employee of the Year. He's going to be honored by them and later in the month in Philadelphia. And next week, County Council is going to give him a proclamation. We're really proud of what he's been doing. He's on the juvenile unit. He was one of our first 3 unit managers. He's done a lot with that population. He continues to do a lot with that population, and we're going to move into hopefully even doing better things for that specialized population. But we're proud of Unit Manager Roundtree being selected by the Prison Society for that award. It's a big deal to us.
We can clap for him.
He works on that unit with some really good corrections officers. He works with a caseworker. They've taken on the approach that that's a team effort. That's not always easy to get everybody thinking the same way when it comes to specialized population like that. But he's worked hard. He's taken those corrections officers on tours out to Highland, formerly Schumann. He's done other things with them to try to introduce the correctional staff to what we're trying to do down there. And I think that team's working really well together, and I look forward to where we go next with that. That being said, as of this week, we're bringing on our final 5 unit managers, so we'll have a total of 8 unit managers in the facility. We talked about that concept back in January, and here we are in September, and we just got approval for the 8th one to be hired. So we're going to onboard 5 of them, and what that means for the facility is we're going to have a unit manager on every level who will be responsible for everything that goes on that level, from the teamwork on that level to working every day with the incarcerated population on that unit. The whole concept is to have one central person on every level who will be the go-to person for the staff and the incarcerated people know who to go to, who's in charge of that housing unit. And we're really looking forward to that being a better way of communicating changes, policy, everything that goes on in that huge building. We want to allow the unit managers to run their levels with guidance from the people in this room. So we're looking forward to that. We appreciate the support of everyone who's helped us get to no unit managers to 8 unit managers in a short period of time. We continue our partnership with Animal Friends, as everyone knows. That's going very well. Today, as a matter of fact, several of us, including a corrections officer, gave an interview to Animal Friends. They have an event coming up in a few weeks that is very important to them, and they ask us, very proud that they ask us to help provide some information about how things are going at the facility with regard to the dogs down there. And one of the officers that works on the unit was happy to give them an interview, along with myself and Deputy Clark and a few other folks. So I don't know sure when that will be broadcast, but hopefully we'll get a chance to see that. We continue with community volunteering. Talked about that for a few months. That's continuing. It seems like every few weeks we have staff going out into the community to volunteer. As of last Friday, they went out again and volunteered, and we have more dates set up. And then we're going to go into the winter months and try to get some volunteer opportunities inside of some places instead of out in the community outside. That's going to continue, and we're continuing to work on something we talked about, I think, a few months ago with an employees association to help improve the morale down there for the facility, to get people working towards looking out for each other. Unfortunately, this week, due to some things that have happened to some of our employees, they've had to engage already and support some of our staff as they go through some issues. But we're looking to create an opportunity for our staff who work there to support each other in a better way than they have maybe before. So that's all I have for right now, unless you have some questions. Thank you.
Deputy Warden's reports.
Good afternoon. On August 13th, we had 15 females graduate from Foundation of Hope program. The Reverend Anthony Igwe began as the new chaplaincy director on September 1st, filling the position that was vacated by Reverend Jacqueline Lyde on August 15th. On August 21st, staff from the Discharge and Release team attended a resource fair at Light of Life Mission. The team was able to gather housing resources and speak with housing providers. In addition to providing parenting classes in the jail, Amachi has also begun providing support to visitors during contact visitation on Saturdays. They're providing activities for children to engage in prior to the visit. Amachi is also providing support to families, including transportation and food assistance, as well as general emotional support. On August 18th, Reimagine Reentry began providing job readiness programming titled Rumble Ready, My Skills, My Future, My Taking Control. This program will focus on what's strong and not what's wrong. Participants work on building resumes, practicing interviews, setting goals, and learning new skills. On August 14th, jail employees met with staff from TransUniting to learn about the services that they can provide to residents of the jail post-release. Jail staff were afforded the opportunity to provide education on the gender-affirming care that the jail does provide to our trans residents. We look forward to a continued partnership with that agency. On August 10th, as the warden had announced last month, Gary Copeland became the jail's new population manager. Mr. Copeland is here tonight. He has worked at the jail for 4 years as an alternative housing coordinator, and during that time, he developed a strong knowledge base of the court processes. In addition, Mr. Copeland has developed relationships with stakeholders, which will be essential to the work of the population manager, so we're very excited to have him on board. On August 21st and 22nd, Amy Krall, the Administrator of Reentry Services, attended the National Restaurant and Hospitality Pathways Conference in Washington, D.C. Community Kitchen Pittsburgh received the Hopes Grow 5 and the Pathway 6 grants, and will be working with residents of the jail to provide culinary training inside and outside of the jail. That concludes this month's report for programs. Deputy Martin will provide a health care services update.
Your Honor, before we go to Deputy Martin, I forgot first thing on my notes because we skipped to the subcommittee. We had 15 corrections officers graduate last Friday. And so they're starting in the facility after graduating, and we have 20 starting the week after next. So we're starting to get some folks through the training and onboarded in the facility. I just wanted to mention that. Deputy Warden.
Good evening. So just briefly, myself, Brandy from DHS, and Josh from CTC Acadia, our methadone provider, we did attend the American Correctional Association conference in Denver a couple weeks ago. We had the opportunity to present a seminar, a 90-minute seminar on our MOUD program and how we were able to implement methadone induction into the jail. It was really good attendance, and we had good participation from the audience, and we got a lot of contacts from them, so we can go back and forth. At that time, DHS also shared, and it's in the report that was emailed to you guys, so the links are in there, the MOUD report from barriers to breakthrough, delivering life-saving opiate use disorder treatment to people in Allegheny County Jail. That report was attached to that, and we were able to share that with all the folks out in Denver. The MOUD dashboard, and then the NASHP data brief on how Allegheny County PA shares information to support transitions from incarceration, lessons for states. So we were able to share a lot of what we do here at ACJ with people from all over the country. It was a national conference, so that was really exciting. And then we also have a big team going to the recovery walk on Saturday, so we'll see you there.
Questions? Go ahead.
Thank you. All right. Okay. The first question is about, I know we had talked in the past about like when people getting money when they get released. Maybe this is a Connie question. People getting money when they get released, and it seems that that has been fixed. We haven't gotten complaints about that in quite some time. But something that's been coming up lately is people not getting all of their personal belongings when they leave. Is there any like time of the day or situation or anything that could happen that would keep someone from being released with all of their personal property? Is it more like a when I hear it, hit you up and say
Yes,
this
please, 'cause
individual person?
there's no reason they should be leaving.
No reason at all. I
without
just
their
wanted to check that.
personal
Okay.
property. Yep.
Is there anything that the jail would confiscate if they had in their personal property?
But if it was contraband, it would be confiscated, and occasionally police keep belongings that don't ever make it to the jail, and sometimes people are not aware of that. But if they have a receipt that they're issued when they come into the jail with the property that they arrived with, then those items they should be retrieving upon release.
Gotcha. Yeah. Okay. Yeah, the person in particular was released with absolutely nothing. So the one that I'm thinking of most recently, so I will let you know about that. The next one is another complaint that I got recently that I realized I never asked about before is condiments and salt and pepper packets and things like that. Is there anything like that that is available for free on the pod, or do you have to purchase every single salt and pepper packet condiment off commissary?
Food is seasoned or salted based upon nutritional value, and that's done through Trinity and their nutritionist. Ketchup is provided. They get 2 packets of ketchup, and it's meal dependent, right? It depends on what's being served. Additional condiments, they would purchase on commissary.
Okay. Even including salt and pepper seasonings? Okay.
Correct.
All right, that gives me a great idea. Okay, next question is about, sorry, hold on, I wrote it here. Something that I've been trying to follow over the past few months is the number of ambulance runs and when they're happening, and I realized that overwhelmingly, we're seeing them during the 3 to 11 shift, and I was wondering if that's something that the jail is tracking internally as well to try to figure out why hospital runs obviously happen as much as they do in general, but also if you're just tracking trends or patterns and I have identified why that might be happening.
We do know when the dates and we know the times. I'm not sure why it's on that shift. Much to my surprise, when I went down and started asking those kind of questions, I thought for sure Fridays and Saturdays would be those. It's not.
No.
It's like Tuesday, Wednesday. So as you know, we put a captain down there a few months ago who is starting to track some trends, working, just yesterday her and I talked about working with DHS and their analysts on looking at some trends and some things that are happening down there. And we had that discussion. Again, I thought it was going to be Friday and Saturday nights. It's not. It's kind of strangely, Monday, Tuesday nights. I don't know why that is. But the data you're seeing is what I'm seeing, which is the most of the trips are in the evenings. It's usually after 4 o'clock. I don't know why that is. I don't have an answer at this point, but we'll
If it's
continue. to look
correlating
at it.
with staffing or nothing like that?
I don't believe so. We're gonna continue to look at it along with hopefully some help from some other, like DHS, and Captain Greenwald's looking at some numbers down there, but I don't know the answer to that. Again, I thought it would be the other days of the week, and it's not.
Yeah. If she's the one in charge of this, I know she will figure this out. I have the full faith in her. So
She's actually today and yesterday, she took some of her staff to the Philadelphia Correctional System to try to learn from some of the things they're doing there that may benefit our facility. So she's her and her staff are on a field trip these last couple of days.
soon they're going to be coming out here to learn from us.
Hopefully.
Yeah, awesome. That's great. My next question is about tablets. It also seems there's a lot of tablets that have been out for repair, which seems to be, that number seems to be creeping up a little bit. As of July 31st, there were 88 tablets out for repair. Some of them had been there for a couple weeks. I was just wondering, has that been improving at all? Like more people having access to tablets? And especially one of my biggest concerns is people on the, what do you call it, New Court Pod when they come upstairs. Are they getting tablets quicker now?
Yeah, there's ebbs and flows with the repair times of when we get tablets back. There were some delays in that for a period of time. Those since have been resolved. I actually just looked at that report yesterday for last month, and last month was much better. We had 71 tablets come in last week that came back to the facility as being repaired. And, our population continues to increase, which continues to mean that we need additional tablets. So we're working with the tablet company to try to keep up with that increase.
And now we have a population manager to decrease that population so that we have enough tablets and many other benefits for that. I think that is, that's all I have. Thank you, guys.
Anybody else? Manny?
Yeah, I just have a few questions. I guess my first one is about the population manager. I want to welcome Gary. I guess I have a couple of questions. Well, first off, I'm happy to see that, there's an ACJ that's dedicated to reducing the population. I mean, I'm looking at the numbers and, it's the highest it's ever been, well, at least, from August 2024 to July 2025. So I'm just curious exactly about how that's going to work. I guess like some more details, or if you can like elaborate on the position itself. And if you're up for it, I would like to hear from Gary himself. Yeah. Oh, okay. Well, welcome. I'm not going to grill you, guys. I'm just, happy to see you. Thank you.
Sorry, what was your question?
Can you just talk a little bit more about your position,
So starting out, like she said, I've only been doing it for like a week or two. So some of the initial things I'm doing is just finding like some of the loopholes as far as why some of the people are still in jail that shouldn't be there. Communicating with the courts, getting the correct paperwork we need, making sure the wording is right. That's like the biggest barrier I found so far. So I'm currently still assisting alternative housing, so kind of doing both. It's just taking me some time to get more information, I guess, to provide about why the numbers are increasing. But that's just preliminarily what I've been able to find.
I got you. And I just read that you've been, for 4 years, the alternative housing coordinator.
Yes.
Can you tell us a little bit more about that?
So alternative housing, I work with passages and renewal, typically providing supervision once a week on site as a liaison between the jail and the alternative housing provider. So while on site, I get to meet with the staff, the residents, assist in any way I can. So sometimes people will reach out, like some of the residents at renewal per se, ask me to find out information regarding their case if I can. And yeah, just kind of really being like that bridge between the jail and alternative housing. So
I'm happy to hear that. And I know you just started. Like I said, I'm not grilling you. But do you have any I guess, like clear and defined goals as of yet?
Honestly, not yet. I'm still working on it though.
All right, got you.
Yep.
Well, thank you. We're happy you're here. We look forward to meeting with you and talking to you more in the future. Appreciate it.
Thank you.
My next question is, well, I guess it's probably my last question, is about releases. Of course, there's been a lot of progress. We haven't had a lot of complaints. And I remember hearing in a previous meeting that you sometimes arrange transportation for folks when they get released. I know you did a bus passes, very, very helpful. But we came across some people yesterday who were from other states and didn't have any way to get home. We ended up getting them home, but is there a mechanism in the jail that exists for that situation, and how does somebody make that happen?
Yeah, so when people go through the Discharge and Release Center, they're part of that process is discussion about how that person's going to get home. They'll let them make a phone call home or give them bus tickets or bus fare if it's local. For those that are going to other states, the Discharge and Release Center will verify that with the person, meaning they're going to want whoever, resides at that residence to say, yes, this person's coming here. But we've bought Greyhound bus tickets, we've bought Mega bus tickets, whatever bus or train tickets that it takes, we've purchased to get people there. So if there's a gap where maybe that team's not honing in on that, we'll talk to them and make sure that they're aware. But we've done that plenty of times before. We also use Uber Health and a variety of other types of transportation for folks.
I got you. So in a situation or a scenario that we came across yesterday, would we be able to engage the Discharge and Release Center directly?
Absolutely. Or you can contact me and I'll make sure that they get what they need.
Okay, perfect. Thank you.
Yeah. One judge. Sorry. Okay. Yeah, because it was 3 people who all came out together. All 3 of them lived in different states, and we had to buy them a Greyhound ticket to Detroit and New York. Detroit, New York, and they didn't speak English, and so, my Spanish minor in undergrad really shone through last night. But it was more just like a surprise. That's not something that we usually come across, that people are released without any bus tickets or any way home.
Right.
And, so it would just be nice to know, was the Discharge and Release Center maybe not open for a period of time, or it should have been open the full hours of release last night.
It hasn't been closed for any out of the ordinary times when releases happen, so.
Yeah, and they all called family, they all had family in the state, so it was we verified because we just wanted to make sure they had somewhere to go.
Right.
And so just kind of wondering how that slipped through the crack.
Yeah, we'll follow up with that team.
Cool, we can do that, thank you.
Did you get their names?
Yeah,
Okay. Good.
I will.
Because we've put people on airplanes. Since I've been here, they've put some money on an airplane to get them to Washington State. So I don't know if it was a quick release situation. We'll check it out.
Yeah.
Yeah,
thank you, we will definitely do that, thank you.
Thank you.
Okay, public comment. Malakia Contrace.
Hi, good afternoon, good evening, whatever time it is for you. My name is Malakia Contrace. I'm a non-practicing lawyer. I started my own mitigation firm early January of 2025, and so have recently been appointed to a few cases in Allegheny County Jail. And the reason for my public comment is that of all of the counties and facilities that I have been in throughout my career, I've never seen a facility like the ACJ that doesn't seem to have a grasp on attorney-client privilege. And so when I am appointed to a case by a judge, it is an order and it presents under the scope of privilege. And since I've been coming to the ACJ, most of those privileges have been violated. And I mean that in the way that the attorney rooms are set up. There should not be multiple attorney tables. Privilege doesn't extend to cases that just because they are legal cases. It is within the team. And so we shouldn't be sharing rooms with other cases and other attorneys and other defense team members. Discovery is being confiscated and reviewed by corrections officers. I recently had to report a very egregious breach of privilege and policy in having a legal meeting with a client, legal visit with a client, that the client was then questioned, interrogated, asked the substance of the meeting, accused me of trying to bring contraband in, and looking me up to say that I'm not on their approved visit list. It's egregious and outrageous. It has been reported, but they took my clients all of their legal paperwork that we were working on and abruptly stopped our legal visit. So I'm here today to say we need to immediately figure out a way to preserve attorney-client privilege in a place where it's a jail. It's not even a prison. So if you're in jail, you're likely awaiting trial. You're gonna have multiple legal visits and multiple team members, and breaching that information is it's an obstruction of justice, in that the defense needs to be able to keep it privileged and clients need to be able to keep privileged so that they can assist their attorneys in their case. That's all.
Thank you. John Kostenowitz. And Mr. Kostenowitz, before you start, sir, John.
What's that? Did the county executive address me, or?
No, that's me.
Oh, you did?
Yes.
Yeah.
Before we start.
Right.
Okay, last month, when you came up to speak at the August regular meeting.
Right.
You had previously sent the entire board and county council an email regarding some incident that took place in the jail parking lot when you were collecting signatures on a petition regarding the referendum, and a racial slur was used towards you, and you had advised the board and county council of this. And when you came to the meeting last month, Ms. Hallam completely misrepresented to the public what had happened, because she said that you sent numerous emails to this board filled with racial slurs, and that Manny responded and said, please do not use that language towards me, and that she would have you removed from the meeting if you use that language. And I'm going to say that you did not send numerous emails to the board filled with racial slurs. You made a report to the board of a slur that was used against you. You did not use a racial slur towards Manny, and Ms. Hallam has no authority to remove anybody from this meeting. But the most egregious thing that happened last month was that after these accusations, inaccurate, defamatory accusations were leveled at you, you were not given a chance to respond. So I'm going to give you a chance.
Judge, he said the full N-word in an email 3 times. The first time he was quoting what he alleged someone said against
you're
him.
out of order.
The second
You're out of
time,
order,
Manny
Ms.
asked him
Hallam.
not to use that word. He typed the N-word by itself. He was no longer quoting what was said to him. Manny asked him a second time to please not use the N-word in an email that Manny and other black people are on, or ever, and he used it a third time. So I believe, Judge, that it is being misrepresented right now and not at the last meeting what he said. The first time, I will give you that. I still think it was inappropriate. Many people say N-word, N star, 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 star. No, because you just accused me of defamation, and I believe that I have a right, if you're going to give this person who used the N-word 3 times in 3 emails, if you're going to give him this, I believe that I have a right to explain myself.
You did speak last month.
And I believe
respond
that,
to this.
Yes,
This is ridiculous.
that's
3
what I
times,
would
the
allow
full
you.
N-word. I hope everybody knows that.
Really ridiculous.
It is ridiculous.
There are not 3 emails. This is just, okay.
Calm down, calm down.
I have a
get to it,
presentation.
calm down.
I want my 3 minutes for this presentation.
I'm
It has
going to
nothing to
give
do
you
with
your
this.
3 minutes,
So can
sir.
I have my 3 minutes?
Sir.
And then, and still respond to this?
Sir.
Okay?
Sir,
So
I'm going to to give you a minute to respond.
Yeah, just a couple minutes, that's all I'm
Go
gonna do.
ahead, go
Okay,
ahead.
Okay, this is all in error, okay? What I was doing was alerting the board to a situation where I received this particular racial epithet. I was not aware of county council's rule that you cannot use that word in any respect, in any form at all. I was not, Bethany, let
Can
me
you
talk.
please not interrupt?
Please.
Racism.
Okay, let him speak.
Judge.
Let him speak.
This is getting out of hand.
I agree.
Okay, this is all I want to say. This is blind ignorance on my part that I didn't know the rule. That's what this boils down to. Well, look at, I am.
See the emails. I have them. I'll send them to anybody that wants to see them. Screenshots of everyone Manny sent and everyone he sent. Judge for yourselves if that's
I am 75 years of old. Bethany, I am 75 years of age. I've worked with African American people 55 years. I have never received.
You know what? Stop talking, both of you, or I'll have you removed from the meeting. Bethany and Manny will be removed from the meeting if you interrupt him one more time.
Okay, I have never received a complaint about my using racial language in a negative way towards black people or anyone else. This is the first time this has ever been done, okay? So this was done out of ignorance. And then I tried to explain the situation with Manny, that, you know, about what my position was, that this was ignorance. And then the conversation just went on and on from there. So do we need to continue this? I want to get to my presentation.
Okay, go ahead.
Okay. Give me a minute to recover here. This is important. Launching of our 2025 ACJ Correctional Officer Job Satisfaction Survey. This coming Sunday, the 7th, we are starting our 3rd annual CO survey. Many officers look forward to their opportunity to anonymously speak to what is on their mind, getting things off their chest and reveal their side of what the issues are working at our jail. The format will be similar to what has been used in our 2 previous surveys. Using Likert scales with close-ended individual statements, and then a series of open-ended questions, giving officers the opportunity to speak to the issues in their own words. The design of the survey was originated by Ann McCafferty, an MBA who was the project director of our city's job program for many years and taught a graduate capstone course on HR principles at Carlow College for many years. One of her specialties was staff turnover and staff retention. As was done in the last 2 years, Google Forms will again be used, which provides very colorful pie charts for the aggregate data and preserves anonymity. The officer's identity is never revealed using this format. Officers can choose to use paper surveys if they like. A special concentration of this survey will be in the areas of security, discipline, and training. It is critical that our officers be given an opportunity to provide their side, revealing their challenges, and talk about their recommendations, being the only jail in our entire state without the use of the restraint chair, leg shackles on hospital runs, and OC spray. Another new area of focus of this survey will be the officer's perception of our Jail Oversight Board. The following close-ended statement using Likert scaling will be provided to the officers. Our Jail Oversight Board communicates effectively with our officers, understands our officers' challenges, and is effectively working to improve the working conditions for our officers. Agree, strongly agree, neutral, disagree, strongly disagree. The open-ended question is, how has the Jail Oversight Board helped you and other officers to improve your working conditions at our jail? What recommendations do you have regarding how the board could be more actively involved and effective in improving your working conditions at our jail? A goal.
That's time, sir.
Okay.
Thank you. Sharon Bonavoglia.
Just after our nation's celebration of Labor Day, we at Penn would like to shine a light on the unpaid work being done by residents in the jail. They clean floors, empty trash, do laundry, and keep the grounds clean, all for a better tray of food and maybe a single cell. Sounds like slavery to us. So we are asking the JOB to do your work by instituting payment to these people. And one more comment about the 5 members who could not manage to show up August 7th. I failed to mention at the makeup meeting on August 20th at noon that your unwillingness to make the JOB a priority required these hardworking administrators sitting here to show up twice in August, robbing them of valuable time doing the labor of caring for our neighbors in the jail. I'm fairly certain they walked over from the jail during lunch hour when Judge Bigley could not be bothered to walk from her chambers inside this building. It also appears that Mr. O'Connor did not want votes to happen on August 7th, on that August 7th meeting, since he was not willing to push the legality of seating Ankur Sakura in his place until the makeup meeting on the 20th. It's important to note that the 5 absent board members required that Manny, Ms. Hallam, Ms. Griffin, and County Executive Innamorato also miss work and or lunch hours for the mandatory makeup meeting on the 20th. I heard that there was a display of frustration at the August 20th meeting when I chose to read the names of the dead. So I want to be clear that what we at Penn will do always is to acknowledge the deaths at every single JOB meeting out of respect for their lives and for their families, and as a continuing reminder that the work you do here has life and death consequences. Please rise for the reading of the names of the dead. Richard Lenhart, Robert Blake, Cody Still, Daniel Pastoric, John Brady, Martin Buchek, Robert Harper, Vinkley Harris, Justin Brady, Paul Allen, Roger Millspaugh, Paul Spisak, Gerald Thomas, Jerry Lee Ross Jr., Victor Joseph Zelenek, Ronald Andrus, Anthony Tallada, William Spencer, James Washington, Damon Leroy Kays, Tim Menino, Douglas Bonomo, Zachary Som, Nicole Barufi, Richard Shuba II, Terrence Clowney, Tracy Hickey, and Justin McCullough.
Please, her 3 minutes is up.
Thank you, Sharon.
All right, I'm going to change the public comment I was going to give, which was, in support of Durante Brown and other incarcerated people who have been assaulted by corrections officers at the ACJ. As everybody knows, the Abolitionist Law Center recently filed a lawsuit on behalf of Durante Brown. I'm going to change my comment because I can't get the image of Judge Ivashevic, a white woman, standing up and putting her finger in the face of a black man who is speaking up against another white man saying the word nigger not once, twice, but 3 times in his emails. And since you did not give them the courtesy of reading the emails, I will. Dear Jail Oversight Board members, I wanted to let you know I just received a text that said, "Shut the fuck up, sand nigger. If this continues, I will make a referral to the police." Manny, John, I'm deeply offended by your email. I've been largely silent and respectful, listening, watching, and reading you insult the Jail Oversight Board and the intelligence of the public. As you're neither black nor Arab, whom that slur is intended to insult, I understand why you feel the need to keep saying it. He responded, "As I've said before, I'm very willing to meet with you to increase understanding and collaboration. We disagree about referendum voting. We both know that it's more shit about referendums. Regarding my statement to the board, exposure brings deference. Keeping this statement, shut the fuck up, sand nigger," second time he says it, followed by 10 people in the dark reinforces further abuse, bringing to light to this board to see how intense this conflict is. In this statement being sent, while I've been very successful in the jail parking lot, no one gives a fuck. He then...
No,
I'm quoting. You're right, the last one.
Nobody gives an F.
You're right, the last one.
I don't think that's a quote.
Okay, I apologize. Anyways, I'll take my 10 seconds back for that reprimand.
No, you won't take your 10 seconds back.
Judge.
Do not speak like that at the podium.
Did I apologize?
This is a public meeting.
Did I apologize?
Please proceed. Your time is ticking.
I'll take all 30 seconds back. He said, "Manny, I've never received these messages from you. I've never received any offer from you or anyone else from the Use of Force Committee. Your allegation that I've used the word nigger third time in any context is false." So you misrepresented what Ms. Hallam said, and you misrepresented what Manny said, and then you, as a judge, put your finger in his face and told him he could not speak up about racism. I will be filing a judicial ethic complaint. I do not care. What you did is wrong, and every black person in this county who sees the way you act should be deeply offended. And I would like to note again that, Judge Bigley has left because nobody cares about these people in the jail more than the people in this crowd and the few people on this jail oversight board who actually do this job, and you are not one of them.
Maria Guido.
Hello, Maria Guido, Transformative Bonds. I would just like to say that those emails deeply offended me, just as a white woman who has both Arab and black people in their family. I also, so basically, I'd like to just take a moment to clarify a few things to the board. I don't come to these meetings to fight or argue with people or scream at people, okay? I actually lose money when I leave here because I own a private practice. So when I'm here, I'm actually losing a couple clients because I'm here, okay? But that's okay. I understand that my passion for this work may come off as defiance to some people on this board. But let me be clear, my only goal is to ensure that the dignity and worth of people are respected in the jail, that the people in the jail are treated with dignity and respect. While I might have strong disagreements with a lot of you, I am fully willing to collaborate with anyone on this board when it comes to changing the culture of this institution. When I speak about trauma-responsive care, I'm not just talking about these kids. I'm talking about the entire facility. I mean the correctional officers and the administration, too. I've seen firsthand the impact of what can happen when you change the culture of an institution. My aim is to help create an environment where emotional safety is prioritized. When people feel safe, they're less likely to react out of stress, which I think we've seen just today. I also want to acknowledge that I really believe that the warden and the administration have shown a real openness to hearing from experts in this field. I just want to, and I do see the progress being made. Again, working with the last administration, there was no working with them, but you guys have actually been very open to hearing us. That being said, I'm not going to be able to fully explain complex trauma and developmental trauma in a 4-minute comment. I would welcome the opportunity to meet with any board member individually so I can share the research behind trauma-responsive interventions and to discuss practical ways we might expand these efforts across the facility. I also want to just remind people who are licensed professionals, when you are in a work setting, what you say does make a difference. Just wanted to clarify that. So thank you for hearing me out. Thanks.
Stephen Fisher.
Hi, I'm Dr. Stephen Fisher, STEPHENFISHER. You'll probably already observed my main motive in coming is as driver to Marion and Dean Dabick. I've been doing this only for a short time, for a couple of years, and I've radically changed what I wanted to say in the last 15 minutes. But what I have noticed a huge change in the tenor of these board meetings in year or so that I've been here. I was so thrilled the first hour of this meeting at all the progress being made. One thing after another, which we've been working for and hoping for a long time, actually being instigated, and people not being ashamed of but proud to talk about. And the meetings didn't used to have acrimony because it would not have been permitted. So I was thinking negatively about that a moment ago. Well, that also is positive in a very positive way. I'm so glad I came today, not in spite of driving through the rain, to hear the really positive atmosphere in this board now. Thanks.
Thank you. Marion Damick.
I don't think I put.
Marion Damick, that's you.
I know.
Yep.
Where am I getting up? Yeah. I want to thank you all for what you did for me the last meeting, for my 100th birthday, and I hope we'll see you next 100.
Holly Hickling.
Hi. I run a human rights nonprofit in Pittsburgh, and I came to talk about Durante Brown, but I did want to say about the people who you needed to buy bus tickets for. I'm very curious if there's appropriate language access happening for Spanish speakers and other speakers who are in anything they would need, but especially also in the discharge. My organization has a training on language access, and if you need any support in that, we can come and talk to you. And if you guys need Spanish-speaking volunteers for what you do, maybe we should talk about that too. Yeah. I'm here today to speak in support of Durante Brown and every person who suffered an assault at the hands of correction officers, those who have spoken out and those who are afraid to. It's unfortunate that this is the second lawsuit filed in the last 2 months due to the use of force against incarcerated people. I would like to remind jail officials that these are our most vulnerable community members. They rely on you to provide their basic human needs and human rights, and they rely on you to keep them safe. What are we going to do to change the culture in the jail? What are we going to do to keep incarcerated people safe? Do you immediately remove an officer accused of assault from that pod? Do you put them on desk duty? Are these people psychologically evaluated? And do you drug test after these assaults? These are questions that need answers if we're going to keep people safe, and the community needs these answers. Thank you.
Corey Roma.
Corey Roma, bouncing off of what Holly just said. It seems that months into the new jail oversight board and a new warden, we are still dealing with high levels of dysfunction. Policies and practices that are not aligned with the rules aren't aligned because the rules aren't clear. Corrections officers do what they want in the ACJ, and the jail oversight board does as they please, operating under bylaws that violate state statute. If the people in charge can't be trusted to uphold the law and follow rules, how can we expect the same from incarcerated people? Durante Brown was assaulted not once, but twice at the Allegheny County Jail because nothing was done the first time it happened to him. There's no accountability because we can't trust those in charge to hold people accountable. I hope we see more aggressive and enforceable changes in the jail because we are letting down the people who matter the most, the people who need us the most, the people in the ACJ. Thank you.
Travis Struthers.
Well, first of all, when my boss told me down here, I didn't know I was speaking, only here to take notes. But my name is Travis Struthers. He spoke on us earlier today. I'm with Reimagine Reentry. We're currently now in the county working on release programs. We actually have one outside of the county as well, so where we basically are providing resume build and job seeking working with education, transportation, clothing. We have I think a 6-week program in the county for the men, 5 for the women, but we also continue it on the streets as well. So that's pretty much my time. Just was here to give an introduction. Thank you.
Thank you. Okay, do I have a motion to adjourn?
Motion. Second.
All in favor? This meeting is
Aye.